who outgrow peanut or egg allergies outgrow them by the time they turn 6 years old. Dr. Reena Mehta with Uptown Allergy joins us now to explain. Dr. Mehta, good morning, and as always, we appreciate you being with us.
Good morning. Thank you so much for having me.
So tell us about the findings of this study and how exciting this is for families who are dealing with children with childhood allergies such as peanut allergies.
Yeah, so this is very exciting information. This was a recent study published in the Journal of Allergy and Clinical Immunology in Practice, where they looked at children age 1 to 6 years of age. And basically what they were looking for was, what are the risk factors to make food allergy long lasting? And also, what are the chances that kids would outgrow these allergies? So when it comes to egg allergy, they found that 90% of children by the age of 6 actually outgrew their egg allergy. And for peanut allergy, 30% of children by age 6 actually outgrew their peanut allergy. So these are higher percentages than we previously have reported. So that's exciting, is that there is some hope that your child could potentially naturally outgrow their food allergies by the age of 6.
And I know, obviously, if you know your child has a food allergy, you got to be very careful, with the food that you're having in the house, the foods that you're consuming, how you prepare food. But if, this information's out there now, how can parents go about testing to see if the allergy is kind of going away, or are there groups of kids who, don't try it at all? The allergy is likely going to stay with them longer in life, if not all the way through life.
So that's a great question. And so really what this study looked at was exactly what you just asked me. And so what they found was, so this should be in conjunction with your allergist. I should say that parents should be trying to give the allergenic food at home to see if their child is still allergic. Once your child has a reaction or you figure out that they have a food allergy, you should be in close contact with your allergist, who will do allergy testing and skin testing to see whether you are outgrowing your allergy. And so what they found was that the children who do not necessarily outgrow the allergy were those who had early onset eczema, those who had very large reactions on their skin test, or those who had multiple food allergies. So with these three factors, it's less likely to outgrow the food allergy. But when you see your allergist, usually once a year, to trend whether you are outgrowing your allergy, they do usually an allergy skin test or an allergy blood test, and they look at whether either the numbers are going down or the reactivity of the skin test is going down, which shows that you are outgrowing your allergy. And so there is hope that you could outgrow it, but there is still some patients who may have that lifelong allergy.
But always a conversation to have with your doctor, not anything that you should be testing or trying to figure out at home on your own. The other thing, Dr. Mehta, that you mentioned to us, we've talked about in the past, is that, typically you don't introduce peanuts or peanut products or nut products to kids until they're older for fears of peanut allergies. But I know recent research has showed that you could actually start introducing those foods to children earlier, but again, under medical guidance, correct?
Of course, exactly. So the old frame of thought was delay, delay, delay. And what we found was that the more delayed we did giving these allergenic foods, the more food allergy we had. And so we came back over the last several years and said, actually, what we found is early introduction of allergenic foods, especially in infants at risk, when they start solids, has been actually preventative for food allergy. So if you have a 4-month-old baby and there is a family history of food allergy, your baby has eczema, obviously in contact with your allergist, the recommendation is to give those allergenic foods, specifically egg and peanut, early. If you can give the foods early, you can actually prevent the onset of food allergy.
But we have to reiterate, do not try this at home on your own, willy-nilly. Do this in a doctor's office with your doctor, just in case things don't go as planned, correct?
And how, yeah, exactly. You should always be prepared for a reaction, and obviously talk to your pediatrician or your allergist about how to safely introduce allergenic foods and how you could either do that in the office or do that at home. And let's say it looks like your child is not outgrowing their food allergy. They're getting more reactive over time. Then there are ways to do what we call oral immunotherapy. Basically, the concept of that is desensitization to the food that you're allergic to. You're giving increasing doses of that allergenic food to basically shift the immune response from thinking it's allergic to building a tolerance over time. Now, again, you do that with your allergist. It's a whole protocol that we have that we do here in the office. But basically, there is a way to cure yourself of food allergies. If you're not going to naturally outgrow your food allergies, there are protocols that we can use to help you outgrow your food allergy through immunotherapy, desensitization, and building a tolerance to those foods over time.
Well, Dr. Mehta, really good news for families that have children suffering from food allergies, that there are lots of options out there. But again, it just takes conversations with your doctor. We appreciate your time this morning, as always.
Thank you so much for having me.